Between hemodialysis treatments, weight gain shouldn't surpass A. 10% of dry weight, B. 8% of dry weight, C. 5% of dry weight, D. 1% of dry weight. A chronic kidney disease patient has started threatening a member of his family. He declares that he intends to shoot the victim and that he wants them dead. The major duty of the nurse is to A. Warn the person at whom the threats are directed, B. Refer the patient to a psychiatrist, If Ms. Precky's spouse is disease-free, she queries the nurse as to the likelihood that any children may contract the illness. Should the nurse tell the patient that a child will A. Have a 100% risk of developing the disease, B. Have a 50% risk of developing the disease, C. Have a 25% risk of developing the disease. Patients taking oral iron should be encouraged to enhance absorption, right? A. Take the supplement with phosphate binders. B. Take the supplement with dairy products, such as milk. C. Take the supplement on an empty stomach. D. Take enteric-coated preparations of the supplement. Patients taking oral iron should be encouraged to enhance absorption, right? A. Take the supplement with phosphate binders. B. Take the supplement with dairy products, such as milk. C. Take the supplement on an empty stomach. D. Take enteric-coated preparations of the supplement. The gradient of a substance's concentration, such as urea, during peritoneal dialysis. A. Remains consistent. B. Varies widely. C. Increases. D. Decreases. The target weight loss for Ms. Precky's hemodialysis session has been determined by the nurse, but the patient claims that the target is incorrect and is 1 kilogram too high. The nurse ought to A. Reassure the patient that the target is correct. B. Advise the patient that 1 kilogram is inconsequential. C. Recalculate the target weight loss. When added, what causes peritoneal dialysate to become hyperosmolar? A. Chloride. B. Glucose. C. Sodium. D. Bicarbonate. Which level of requirements has the highest priority when using Maslow's hierarchy of requirements to define priorities in nursing care for hemodialysis patients? A. Self-esteem. B. Physiologic. C. Safety and security. A person with kidney illness in stage 4 is thinking about his alternatives. The patient should be aware that the highest percentage of survival is linked to A. Hemodialysis. B. Peritoneal dialysis. C. Preemptive transplantation. It is very common for an end-stage renal disease (ESRD) patient with human immunodeficiency virus (HIV) to be co-infected with which of the following? A. Hepatitis A. B. Hepatitis B. C. both A and B. The intervention of diuretics for the patient with nephrotic range proteinuria would be used for which of the following? A. The patient with nephrotic syndrome. B. The patient with edema. C. The patient with nephrotic range proteinuria. D. None of the above. All of the following occupational environmental toxins can potentially affect the patient with chronic kidney disease, except A. Silica. B. Heroin. C. Lead. Patients with chronic kidney disease, CKD, have the highest risk for cardiovascular disease. What is the most common cardiovascular complication of patients with CKD? A. Pericarditis. B. Coronary artery calcification. C. Hypertension. A person with kidney illness in stage 4 is thinking about his alternatives. The patient should be aware that the highest percentage of survival is linked to A. Hemodialysis. B. Peritoneal dialysis. C. Post-dialytic transplantation. What is the best way to make sure a patient is aware of the discharge plan when they are leaving the hospital and will be referred to a home health organization for help with peritoneal dialysis? A. Have the patient complete a post-discharge survey. B. Telephone the patient after discharge to discuss the discharge plan. The progression of diabetic nephropathy can be delayed by the use of what type of medication? A. HMG-CoA reductase inhibitors. B. ACE inhibitor medication. C. Anticoagulants. D. SSRI. Which of the following are tubular portions of the nephron? A. Loop of Henle. B. Bowman's capsule. C. Proximal tubule. D. All of the above. Viral infections are considered to be the source of several kinds of glomerular diseases. Which one of these might be caused by the human immunodeficiency virus? A. MGN. B. MPGN. C. FSGS. Which of the following would be included as potential causes for acute renal failure? A. Kidney infection. B. A crushing injury. C. All of the above. The use of a biocompatible membrane dialyzer could potentially help prevent which of the following complications? A. Amyloidosis. B. Interleukin-1 stimulation. C. Both A and B. Which of the following is considered to be the most significant side effect of recombinant human erythropoietin, RHUEPO? A. Nausea, vomiting. B. Headaches. C. Hypertension. Bacteria that cause infections that are acquired from dialysis equipment would be considered which of the following? A. Endogenous. B. Exogenous. C. Enteric. Which would be considered the most abundant organic waste excreted by the kidneys? A. Nitrogen. B. Urea. C. Sodium. D. All of the above. All of the following are considered to be common sterilization methods for the hemodialyzers except A. Steam. B. Gamma irradiation. C. Pressure. Besides electrolyte and pH changes, which of the following etiologies could potentially be responsible for a patient developing dysrhythmias? A. The stopping of antiarrhythmic medications with dialysis. B. Infection. C. Acetate dialysate. Which of the following interventions could be correct for the treatment of neutropenia in the hemodialysis patient? A. Administer oxygen. B. Draw all CBCs before dialysis. C. Administer antiarrhythmias. D. None of the above. What stage of chronic kidney disease does a patient reach before being referred to a nephrologist? A. Stage 1. B. Stage 2. C. Stage 3. D. Stage 4. Which of the following terms would be correct for the pressure that a liquid exerts against the wall of its container? A. Removal. B. Ultrafiltration. C. Hydrostatic pressure. D. None of the above. The term for an infection of the lower urinary tract would be which of the following? A. Pyelonephritis. B. Toxicity. C. Cystitis. D. None of the above. Which of the following would be considered to be an appropriate intervention for the hemodialysis patient to help prevent intradialytic complications? A. The use of acetate dialysate. B. The use of bicarbonate dialysate. C. The use of glucose dialysate. If the hemodialysis patient has a history of seizures, which of the following interventions might be correct for the patient during dialysis? A. The administration of an additional dose of anticonvulsant during hemodialysis. B. Have the patient inform the nurse if they feel they are about to have a seizure. Which of the following is considered to be a major diagnostic tool for evaluating a patient with renal abnormalities? A. Urinalysis. B. CT scan. C. Serum electrolytes. Which of the following are considered calcium-based phosphate binders? A. Calcium citrate. B. Calcium carbonate. C. Calcium acetate. D. All of the above. The physician wants the ESRD, end-stage renal disease, patient to take calcium carbonate phosphate binders. Which of the following of these should the nurse know of? A. Oscal 500. B. citrical, C. Amphogel. Which of the following principles of postoperative peritoneal catheter exit site care would not be correct? A. The catheter should not be immobilized. B. Only trained staff should change the dressings. C. Only sterile water should be used to rinse the exit site. Which of the following factors might be related to abdominal pain with peritoneal dialysis? A. Dialysis technique. B. Catheter position. C. Both A and B. D. None of the above. Which of the following medications is not eliminated with peritoneal dialysis? A. Metformin. B. Mannitol. C. Sulfasalazole. D. Salicylate. With a child who is on peritoneal dialysis and is still in diapers, which of the following would be strongly recommended? A. A very short tunnel with the exit site at least an inch from the diaper area. B. A long subcutaneous tunnel with the exit site well away from the diaper area. Which of the following can result in post-catheter implantation incisional leaks when dialysis is initiated? A. Malnutrition. B. Friable tissues. C. Diabetes mellitus. D. All of the above. The peritoneum consists of 3 layers. Which of the following would not be one of the 3? A. Mesothelium. B. Basement membrane. C. Myothelium. If the dialysate solution is a 2.5% solution, it would have which of the following for osmolarity? A. 485 mosmol. B. 296 mosmol. C. 396 mosmol. Which is the most common bacterial infection post-renal transplant? A. Wound infections. B. Urinary tract infections. C. Sinus infections. D. None of the above. Viral infections most often occur after the first several weeks following the transplant. Which of the following can be a major cause of morbidity or mortality in the transplant recipient? A. Herpes simplex. B. Cytomegalovirus. Which of the antiproliferative agents needs to be refrigerated? A. Rapamune. B. Imuran. C. Myfortic. D. Celcept. Which of the following is a surgical approach to the kidney donor surgical procedure? A. Laparoscopic donor nephrectomy. B. Open donor nephrectomy. C. Closed donor nephrectomy. D. Both A and B. Which vitamin is used for the treatment of hyperhomocystinemia? A. Vitamin D. B. Vitamin A. C. Vitamin B1. D. Folic acid. When assessing kidney function in children, the standard CKD staging system based on glomerular filtration rate (GFR) differs from an adult. Until the child reaches what age? A. 1 year. B. 2 years. When determining glomerular disease, GD, a patient presents with proteinuria in the urine which is more in the nephrotic range. What stage would the patient most likely be in? A. Mild. B. Chronic. Systemic diseases that have renal involvement with a low serum complement could include A. Subacute bacterial endocarditis, 90%. B. Goodpasture's syndrome. C. Shunt nephritis, 90%. D. Both A and C.